So this confounding is a problem. Now confounding can occur in two ways. One is when both the factors that are confounded are treatments, something that is applied by the researcher. Now that type of confounding is pretty rare because if you are applying, you naturally remember to apply all possible combinations, like the fertilizer and variety example. You would rarely apply only one kind of fertilizer to one variety and a different type of fertilizer to a different variety. You will know that you have to apply all possible variety fertilizer combinations. That's nothing very difficult, and it rarely occurs. But it inadvertently occurs in situations where at least one of the factors involved happens to be a control factor that is beyond the direct influence of the experiment, or something like gender or medium of instruction and things like that, or the religion of a person. In that case, you use the technique called blocking to avoid confounding. So the idea is again very straightforward and basically like a common sense idea. Suppose you have some kind of a medicine and you suspect that its effect might be different for men and women. Then it is not just enough to collect a group of patients who are all that is a mixture of men and women. It is important that you carry out the experiment separately for the men and separately for the women. So if you just take a collection of patients who are as identical as possible with respect to everything else except their gender and the medicine that you are going to apply, and then you take half of them randomly and apply your medicine, and for the remaining half you apply placebo, that is not a good way of carrying out this experiment. Because in this case, it might happen that when you did that random allocation, most of the males got your medicine and most of the women got your placebo. In that case, you do not know if you see that there is any difference between these two groups, whether it was because of the gender difference or because of the treatment difference. So what you should do is that you should split it up into two groups. Take the men on one side, take the women on one side, then split these men into two roughly equal halves, apply the medicine and the placebo separately, independently. You also split the female group into two roughly equal halves and apply the medicine and the placebo. So whatever you do for this group, you do separately for that group. Then you can really do the comparison, because if you compare the placebo men and the treatment men, then you can see the difference between placebo and treatment, the gender effect remaining the same, similarly for women. And if you compare the treatment men with treatment women, then only the gender is changing, so you can get an idea about the effect of gender. So do not change both the things simultaneously. That's the main idea. Similarly, if age group is also an important thing, and if you have say 3 age groups, young, middle-aged and old, in that case you should split the entire thing into 6 different groups. That idea is called blocking. This is a block, that's a block, and that is the idea of blocking. So if you cannot control that factor like gender, at least you create blocks where within a block everyone is homogeneous with respect to that control factor, like everyone has the same gender. Similarly, there you will do it in 6 groups: young men, young women, middle-aged men, middle-aged women, and like that. And then you can apply. So that is the concept of blocking.